Robert F. Kennedy Jr. has been sworn in as U.S. Secretary of the Department of Health and Human Services.
On which I'm about to enter.
So help me God.
So help me God.
Congratulations, Mr. Secretary.
Trump's appointee will oversee several high-profile agencies. That includes the Food and Drug Administration and the Centers for Disease Control and Prevention. During Kennedy's hearings, Senate Democrats pressed him on several of his stances, like his controversial views on COVID-19 and false claims he has made about vaccines causing autism in children. The Senate confirmed Kennedy's appointment today in a 52-58 vote. Republican Senator Mitch McConnell was the only Republican who voted no. But there are concerns on this side of the board about the kind of rhetoric that he will bring. Dr. Josh Reimer is the president of the Canadian Medical Association, and she joins us tonight. Doc, what is your reaction when you heard that Robert F. Kennedy was voted in?
Well, we already know that misinformation is a major problem for Canadians. This is something that we are hearing in our day-to-day lives as physicians when we're trying to talk to patients about their health and healthcare decisions. But we also know that misinformation does not respect borders. So anything that happens in other countries, particularly our closest neighbor, is going to affect Canadians and affect their health. And so it's definitely something that we're paying attention to and we're worried about and want to make sure that Canadians have access to trustworthy information.
I mean, how concerned should we be? We saw what happened with COVID and some of the things filtering in here from America. How concerned are you of the effects that this could have on Canada now with him holding that role in the U.S.?
Well, we're very concerned about any misinformation because we know that misinformation hurts Canadians. We did a survey and we actually found that 37% of Canadians are telling us they have no choice but to get their information about their health online because they don't have access to a family doctor. And so, speaking both as a public health physician and as president of the Canadian Medical Association, I am so genuinely worried about this number because we've never had a generation that was so bombarded with misinformation and had such an issue with lack of access to their own trusted healthcare professionals that they can talk to. And when we see the normalization of some of this misinformation happening around the world, that's just going to make things worse and make it even harder for Canadians to try to figure out what are the best decisions for their own health.
Yeah, and giving them that job is definitely a form of normalization. Canada is looking for a new top doctor, and seeing with what's happening in the U.S., how might that affect our choice here for that job?
You know, it's really important that Canadians have somebody that they can go to for trusted information. We need to make sure that we have online sources, that we have trusted experts, people who are there providing that information to Canadians, because everybody is trying to make the best decisions they can for their own health. I had a patient when I was at the hospital recently who declined a blood transfusion even though she needed one because she didn't want to receive vaccinated blood. So sometimes this is truly life or death situations for people who are trying to do the best they absolutely can for themselves. So we need to make sure in Canada that we're investing in creating these trusted sources of information, whether it's the chief public health officer, whether it's the Public Health Agency of Canada's website, Health Canada's website. These are all really critical places that we need to make sure are standing strong and available to Canadians when we know that we're going to have less reliability on the information that we get from outside of Canada.
There is reportedly currently a measles outbreak ongoing in Texas. It's being linked directly to parents not vaccinating their children. Is this our future now with all this misinformation circling about, especially about vaccines?
These are the exact stories that are so heartbreaking to hear because the measles vaccine is 97% effective at preventing measles. It's such an incredible tool that we've developed. But because people are hearing this scary information that's not true about the measles vaccine, they're choosing not to get vaccinated, trying to make good decisions, and children are getting hurt. Some will just get mildly ill, but some get severely ill, and some children die. And as a physician, when you know that there's this tool that protects people, it's so heartbreaking when you see them getting taken over by misinformation. And I think this is what we're going to see in the future. We're going to see more outbreaks like this. We're going to see more children being hurt. And so it's really critical that as health professionals in Canada, as the organizations that are trusted by Canadians, that we really amp up our work to make sure that Canadians can see this trusted information so that they aren't going to be as susceptible to this misinformation that they're being bombarded with, especially on social media, where the algorithms push misinformation on people, whether they're looking for it or not.
I feel I can hear the worry in your voice, Doc. So how damaging do you think could having RFK Jr. as health secretary be to public health in the U.S. in the long term?
We're seeing a lot of things that are concerning about the decisions being made when they're pulling information down from the CDC website. There's, this is somewhere we were looking for regular updates about bird flu, for example. We know that that's now being delayed.
Wow.
And so there's a lot of things that are really important that we used to rely on and share information across borders. I don't know what's going to happen. And that's what makes me worried, because this is a relationship that we built over many, many years to share information, to work together, to promote science, to promote the health of everybody in North America. And if we need to not rely as much on their information, that's going to harm Canadians. But we do know that we then need to make sure we're bolstering our own information to make up for that.
We've beaten polio, we've beaten measles. It feels like we're going backwards here. Dr. Josh Reimer is the president of the Canadian Medical Association. We appreciate your time tonight, Doctor. Thank you.
Thank you so much for having me.